Hi, I'm Bridget, and I'm a science intern at the CACNA1A Foundation. I have great news to share with our community. CACNA1A related disorders was just awarded its own ICD-10 code that will go into effect on October 1st, 2025. The code is QA0.0102, shown here on the slide, which officially recognizes CACNA1A related neurodevelopmental disorder, CACNA1A NDD. This is the result of a collaborative effort that started last summer to increase visibility for our disease. In this video, we'll discuss the importance of an ICD-10 code and what it means for our community. ICD-10-CM is the International Classification of Diseases, 10th edition, clinical modification. This is a standardized system used by the World Health Organization to chart diseases. In the US, it's enforced by the CDC and is utilized by healthcare providers, insurance companies, and even pharma companies to keep track of diagnoses. Each code is specific to a unique disease or condition, allowing for a more efficient and accurate method to keep track of diagnoses across locations, times, and healthcare systems. Each time a person receives medical care, their symptoms or conditions are recorded in their medical charts using ICD-10 codes. There are countless codes available. For example, there's an ICD-10 code for someone being bit by a duck. Or, more relevant to us, there's an ICD-10 code for someone with epilepsy, or ataxia, or developmental delay. These codes are also incorporated into a large database that allows clinicians, researchers, and insurers to access the information for a variety of reasons. Insurance companies can learn more about the types of services required for a specific medical condition. Clinicians can easily access and retrieve health information, such as symptoms and services, to improve care management and decision making for their patients over time. Even pharma companies use ICD-10 codes to learn about a patient population, track disease prevalence, study the effects of current drugs, and identify potential areas for research and development. All the information provided is de-identified, meaning that there's no identifiable personal information, such as name or address, included in the database. Without a unique ICD-10 code, rare conditions like CACNA1A and DD are essentially invisible to the healthcare system. Up until now, CACNA1A symptoms have been coded using a variety of different ICD-10 codes for epilepsy, global developmental delay, ataxia, use of a wheelchair, etc., without any reference to the root cause of these symptoms. This has made it extremely difficult to track how many people are living with and being treated for CACNA1A and DD. Having our own ICD-10 code will benefit the community in many ways. As mentioned earlier, clinicians will be able to identify typical medical services or interventions that are effective for CACNA1A patients. The World Health Organization, the CDC, and other public health organizations can provide better prevalence and incidence rates, which are often difficult for rare diseases. And pharma companies can also access important health information about CACNA1A and DD to help with treatment development and clinical trial design. For example, a doctor who's never encountered anyone with CACNA1A and DD could be seeing a CACNA1A patient and isn't sure how to manage care. The doctor could search for QA0.0102, our ICD-10 code, and learn that many patients benefit from interventions such as physical, occupational, and speech therapy and might make the right referrals. They might also learn about medications that can address major symptoms like ataxia or epilepsy. They could even see that chronic constipation is common and recommend a GI specialist, other things like that. The code QA0.0102 might just seem like a bunch of letters and numbers. There's a systematic method of developing an ICD-10 code. Here's how our code was generated. Our code is part of a brand new category, QA0, for neurodevelopmental disorders related to specific genetic pathogenic variants. From here, we're categorized under subcategory QA0.01, neurodevelopmental disorders related to pathogenic variants in specific genes, QA0.010, neurodevelopmental disorders related to pathogenic variants in ion channel genes, and finally, our CACNA1A and DD code QA0.0102. All of these subcategories may seem repetitive, but the system aims to ensure the greatest specificity and detail in classifying diagnoses. It's important to note that the new ICD-10 code for CACNA1A and DD will not replace any existing codes in your medical records. It's used to identify individuals with CACNA1A and DD in addition to the specific symptoms that have previously been coded. Below is an example of what medical records might look like for an individual with CACNA1A and DD after October 1st, 2025. So, as you can see here, the codes that address the specific symptoms or CACNA1A related disorders are still listed, along with codes that may have nothing to do with CACNA1A, like a peanut allergy. But as of October 1st, you can ask your providers to add our code, QA0.0102, and this individual's medical records will reflect that they have a CACNA1A variant, which they previously did not. So now that you know the importance of an ICD-10 code, we need your help. Please share this code with your providers. The ICD-10 code is an important step toward increasing the visibility of CACNA1A and ED. The foundation will be rolling out materials that can be printed off the website or mailed to families, like a poster, business card, keychain, stickers, etc., to help families remember and share the code. You can also find more information about ICD-10 on the blog page of the CACNA1A Foundation website. Let's get this code into the records of every patient with CACNA1A and ED.